Hello, welcome to this talk on wildlife. We're going to be talking about first aid and triage for commonly seen wildlife in practice. These species that we'll be covering is mainly birds and hedgehogs. Okay, so the learning objectives that we will cover are legalities and ethical considerations about these wildlife species. We'll also be covering initial considerations when admitting and triaging frequently seen wildlife in practice. We'll also then go on to cover fluid administration and techniques, commonly seen diseases and ailments, and then more specifically we'll be covering hedgehogs, their common parasites and treatment options, and how we can help get kick-started with treatment before they go off to rescues. Okay, so we'll be talking about legalities first. So the Wildlife and Countryside Act of 1981 is one that protects UK wildlife from being killed and controlled by certain methods, those methods being inhumane methods such as gassing and traps. It can be interpreted that this act implies that the rescuer of a wildlife species becomes the legal owner of that animal and therefore then becomes responsible for its ongoing care. So to get around this, we do have the wildlife consent form. So if a member of public brings in a wildlife that is in need of care or rescuing, that we get them to fill that wildlife form in as thoroughly as possible. It also has a little bit in regards to sharing their data with the rescues, as a lot of rescues do like to know where the species has come from, and hopefully can then get it re-released in a similar area. So it's really important that we make sure that clients are consenting to this part or not consenting, so do make sure that that gets ticked. So the act after this, the Animal Welfare Act, which a lot of you will be very familiar with, so that's 2006. So this act means that it's a criminal offence to allow a protected animal to suffer. The only downside to the act is that animals are described as being vertebrates that are other than man, so things like slugs and snails and non-vertebrate species are not protected by this act. It's protected accounts for animals not living in a wild state. So that is your rehabilitated and or released wild animals. So next up we have the Veterinary Surgeons Act of 1966, again another familiar one to us all. So this act penalises those who practice veterinary surgery without being enrolled by the RCVS. And another relevant act is the Veterinary Medicines Regulations of 2013. So this is essentially drug categorisation. Some medicines that are used in wildlife rehab require a veterinary surgeon to prescribe, so it's quite a relevant act to note for this. And there are lots of others in terms of legalities, but the above ones I feel are the main ones that we should be aware of. Moving on to ethical considerations. So it's really easy to put our own thoughts and feelings and emotions into the treatment of wildlife, but I think it's really important that we consider each situation from the wild animals' point of view and not our own. You know, these animals, they're hardwired to survive, and captive animals that are used to being out in the wild and not interacting with people, they're perceived as happy if they're performing their expected behaviour, but this isn't always the case. 9.9 out of 10 times they are definitely stressed, and hidden stress can cause profound psychological, physiological responses, and it can increase their parasitic burden, meaning they're not coping at all within captivity. We also need to consider whether the patient can be re-released in a state where it can still thrive and compete with others of the same species. So ultimately, when it comes to rehab and rescue, there are two outcomes, and these outcomes should be release or euthanasia. There should not be situations where an animal cannot compete. or thrive of being re-released fully. Just because we can do things doesn't mean that we should. Some good examples of this is blind hedgehogs in captivity. Their normal territory is acres and acres of land, and if they're just housed within a small garden and they can't get out, it's very stressful for them. And if they're blind, they don't use their eyes as much as their nose, but still, if they can't see at all, it's not ethical. It's not fair for them to carry on in that captive situation. Also, as well, with hedgehogs, things like amputation of limbs, they rely on their front legs a lot, for just day-to-day activities, for thriving. If we take that away, they cannot perform normal behaviours out in the wild, and they cannot compete with their counterparts. So the kindest thing to do would be euthanasia. As awful as it is the kindest thing. The most important thing is quality of life. That is paramount when it comes to our wildlife species. Okay, moving on to initial considerations for our wildlife. So the utmost important question is, does this animal need to come into us? Does it need to be seen by a vet? Do we need to interfere with its day-to-day life? And I think ultimately, with all wildlife, regardless of species, if it is physically injured and it is suffering, then it does need to come in with us, and we need to give it veterinary intervention. We do not want any animal to suffer or its welfare to be compromised. So if we do get a call and a client says, oh yes, it's injured, I can see a physical injury, then we get it in with us. When we're talking specifically about fledglings, so the guidance can differ slightly depending on if they have feathers or if they don't have feathers. Now this guidance I did get from the RSPCA website. It is public knowledge, so you can go on there, and they do have a lot of helpful guidance for wildlife and what to do when you see them out in the wild. So for fledglings specifically, those with feathers, it's important that most of the time it's just monitoring really, unless they are physically injured. Most of the time, fledglings with feathers, they are just learning to fly, finding their wings. It can be a little bit up and down as to how well they can fly. So unless it is, again, physically injured, guidance for the public is just to monitor these creatures. If a fledgling does not have feathers, it's ever so slightly different. Most likely that it's fallen out of the nest or been got by a cat or something like that. If it's physically injured, I've repeated myself a lot, but if it's physically injured, then it's really important that we do get them in because they might need veterinary intervention. Otherwise, if they're not physically injured, the RSPCA guidelines is to place that fledgling back into the nest. Most of the time this isn't doable because the nests are very high up in the trees and you do not want to risk your own safety, so do make that clear to members of the public that do ask. They're not to climb the trees and put themselves at risk. If they can't reach the nest, then the RSPCA do advise that we create some kind of makeshift nest. So that can be like a little bucket or a box with some leaves and a little blanket sort of in a circle, and we put them slightly higher than ground level so they're not at threat of a domestic cat, for example, or a fox, something that can come in and eat it. If there is no change and the mother doesn't return and it's still in the nest, within a few hours, then that guidance would be to bring it in, because unfortunately, if the parents don't come back, then it's definitely going to die if it doesn't have intervention. So we can get it to a rescue, and they have things like incubators and stuff, and they're very good at fostering these little baby birds. So when we're looking at our hedgehogs, again, if any injuries, physical injuries, we bring them into us. Other reasons why we want them to come to us is if it's a juvenile or a hoglet, so very small ones without the spines, or anyone that sort of weighs less than sort of 600 grams is usually ones that need help and need intervention. It's really important with hoglets as well, if a member of the public does find them, that they go back out and look for others. It's most likely that either a nest has been disturbed or that there will be others around. And it's really important to try and find those as well. It's less likely that mum's going to come back if the nest has been disturbed. They do make really tiny, like kind of squeak noises, so it's good for the members of the public to listen out for that. And as well, when they fill in the wildlife consent form, a good location area of where they were found is really important, because even if they can't go out and look for the hoglets, it's really important that the rescues might go out and have a look as well, just so we can get the litter together. Another reason why hedgehogs should be brought in is if they are lying out in the sun and look as though they are sunbathing. They're most definitely not sunbathing. It's most likely that they've got themselves dehydrated or a severe parasite burden, and these hedgehogs need help, otherwise they will slowly die out there. This is tied in as well with lethargic. Usually the ones lying out in the sun or sunbathing are also lethargic, but any that look as though they're sort of splayed out with the legs, or really not responding or curling up when they're being interacted with, it's really important they also come in, and we can help intervene. And finally as well, any sort of respiratory distress, so really noisy breathing, or any sort of abdominal effort when they're breathing, make sure we get those in as well for treatment. We do leave hedgehogs alone if they are out and they're actively moving towards a goal. So they're, confident movements, really, strong, well movements. Things like crossing the road doesn't mean they're in danger, especially when they're out in daylight as well. That doesn't mean that there is a problem. We do have nesting mothers that go out during the day, either moving their hoglets to a new nest, or getting food out for them as well. And we also leave nests that are disturbed alone. So if a member of the public is doing garden work, and they reveal a den, it's just important to cover it back up, and that they watch for the mother to return. So just because the mum isn't there doesn't mean that the hoglets are abandoned. So you usually give it a few hours, and just to see what happens. Don't stay in the garden, go inside and observe. If the mother doesn't return, then we do bring those hoglets in, as I said before. It's really important to know that it's not always transparent. We still need to judge every case individually, and this is all just guidelines, and you can work with the clinical team, and your vets and your nurses together to decide whether it's the right thing for these animals to come into us. Their initial consideration would be the zoonosis risk to us. So these wildlife species do carry diseases that we can get. A few examples of those would be salmonellosis, Lyme's disease, ringworm, avian flu, toxoplasmosis, and mange or scabies, just to name a few. PPE is really important, and ultimately your own safety is first and foremost when it comes to wildlife triage. Zoonotic disease I would like to just cover specifically is avian flu. Um, this is becoming a lot more rife in our area, so it's really important that any phone calls we get from wildlife that are birds, it's really important that if the client is bringing it down, or the member of public, that they are asked to wait outside. And when we initially go out to see these birds, we must wear PPE. And for avian flu, it's really important that we wear specific masks. This mask being the FFP3 masks. So once we're outside with the bird and the member of the public, we have to visually assess these birds. If you have any concerns about sickness rather than injury, it's important that we keep them outside and consult the vets. So sickness being any sort of extreme lethargy, respiratory distress, rather than like a physical cut or broken wing or leg. Usually then the guidance would be to humanely euthanize outside if it is sick, because we don't routinely test any wildlife or birds for avian flu. If we are suspicious of it, then the guideline is to euthanize. So after our initial considerations, we then move on to triage and assessment. First and foremost, it's important that we stay quiet and calm. As I said before, stress can kill, and as cute as these little baby hedgehogs and birds can be, it's important that we don't talk to the patient and we stay nice and quiet. Initially as well, we want to do a hands-off observation. We look for injuries, we look for any smells, any putrid smells. What is the animal doing? Does it look neurological? Is it circling? Is it falling over? Is it twitching? What's its breathing like? Is it noisy? Faster than usual? Any sort of increased effort with that? We also want to look at their demeanour. Are they quite perky in the box? Are they, they're moving around, inquisitive, or are they really flat and quiet, lethargic? It's also important to look for any sort of excrements that might be coming out from them, whether that be poo, whether that be blood, whether that be vomits, and take good note of those. Specifically when it comes to hedgehogs, it's really important that we check the sex of these hedgehogs. So we want to know whether it's female or male, and we also want to take into account whether, if it is a female, is it a nursing mother, because if that is the case, then we need to either get a rescue or the member of public who found it to go and try and look for the hoglets in the area that they found them. For those who aren't sure how to sex a hedgehog, if you look underneath them, you can, the easiest way would be to place them in a clear plastic box, and then you can just lift it up and look underneath them. The males have a little mark where their belly button would be, and that is their penis. Whereas with our females, the little mark or hole is a lot closer to their rectum. There's virtually no space between the anus and the opening of the vulva, so that's the easiest way that you can tell the difference between the sex. It's also important to note the body conditioning score of hedgehogs, which I do have a little slide of either next or the one after, and it will just show you a nice little guidance on how to observe whether they are poor body condition or overweight. It is a really nice sort of display there, so I'll show that in a minute. Following on from sort of triage and assessment, we can obviously do hands-on if we need to, but like I said before, if we can minimise it just to reduce the stress, we might need to do hands-on to manipulate limbs or wings and just to see what's going on, just to get a bit of a better look. It's important as well to remove any ectoparasites you might see. Primarily ticks is going to be the easiest ones that you can remove using a tick remover. F10 is a really good product for fleas as well, and any sort of fly strike. It helps remove those if you use it, but we have to be really careful if we are using F10 because it is toxic to cats, as it's a permethrin based product. It's really important that we do not anaesthetise any of the patients that come through to us straight away until we are happy that they are nice and stable, as all wildlife coming to us will have some degree of shock, even just from being picked up and taken to us. It's really important that we get these animals warmed and that they are provided fluid therapy, obviously prescribed by a vet. We should really greatly consider fluid therapy with these patients. And also it's really important to consider the analgesia. You know, if an animal is coming into us, a dog or a cat, and it's broken its leg or it's cut itself, you know, we give it pain relief. So why should our wildlife species be any different? We want to reduce their suffering, so have that chat with the vets and consider analgesia if it is injured. So here is the hedgehog body conditioning score, courtesy of Vale Wildlife Hospital. I really love this diagram. I think it makes it really helpful and for us to make a decision on what's going on with these species. Obviously, number 3 is the healthy weight. That's what we want to see. Quite often than not, they're coming into us either a 1 or a 2. So that's really important to consider. So if we're moving on to fluid therapy, this little diagram is really nice for assessing dehydration. Just a little chart here going through the different percentages and what clinical signs you will see. Again, it's very similar to our dogs and cats and small furries. I think the most important thing to consider with our wildlife species is our species like hedgehogs have a lot of excess skin, so the skin tinting can be a little bit deceptive to judge. And with birds as well, they don't really have much excess skin, so it's hard to judge the skin tinting. So for these patients, we want to be looking at that eye position. Is it sunken and dull, or is it nice and bright and sort of protruding as it should be? And as I said before, we always, with hedgehogs especially, we always assume that there is some level of dehydration. So you always really want to be assuming that they're at least, 5% dehydrated. When we're administering fluid therapy, I'll go specifically between hedgehogs and birds. So we'll start off with hedgehogs. So their daily requirements are 50 mils per kilo within 24 hours. Common routes of administration is subcutaneous, your intraperitoneal, but bear in mind this is veterinary only as it's entering a body cavity, IV and IO, so intravenous and intraosseous, is almost impossible with these patients. So we don't want to even try this. It can be very difficult to do it with them. Vale Wildlife Hospital has a very nice fluid replacement chart, which I believe is on the next slide, and that is a very quick reference chart for quick percentage dehydration calculations and what they need. It's important that we split the doses if we're giving subcut into around 4 doses throughout the 24 hours. And if we're giving a subcut to avoid prick injuries from the spines, it's a very useful tip is to use artery forceps to help lift up to the spines to form the tent. So if you haven't tried that already, do try it next time you give subcut fluids. It is a game changer. So with our birds, again, their daily requirements are the same, 50 ml per kilo within 24 hours, and similar administration routes, subcut. Crop feeding is a different one. You can give water that way, essentially oral administration. Intravenous is useful in your bigger birds. It can be very difficult in small birds. And you can also do intraosseous in birds as well, which I haven't actually added in this slide. Important to consider that birds do have limited subcut space, so we do have to be cautious with the volumes used at one time. This volume usually being about 10 to 15 ml per kilo per bolus, and this should not exceed 10 to 20 ml per kilo per single injection site. Also, really important to remember that we should always spirit swab the skin before any kind of injection into our bird patients. This is because they are a lot more susceptible to getting infections in the skin. Here's the lovely fluid replacement chart courtesy of Vale Wildlife Hospital. So it just has nice columns with the average weight of the hedgehog and the daily maintenance that it would need, and then deciding on, depending on what its percentage dehydration is, you then add the volumes in the latter three columns to the daily maintenance to give your total volume in 24 hours. So these images are some really nice sort of areas where we can give subcut fluids to birds. The two most common sites to use is sort of your inguinal region and then just behind the back of the wing, just to the side of the shoulder blade. I'm afraid I don't know the official terms for them, but I'm hopefully these diagrams will give you enough guidance. Okay, so now we'll move on to some commonly seen injuries and diseases. We'll start with birds. So on the left, there's a disease called canker. So this displays as yellowish plaques or cheesy lesions within the mouth, throat, or crop. It can cause difficulty swallowing, or it can make the bird regurgitate. Usually treatment for this is euthanasia. Unfortunately, it's very difficult to treat unless that it's early lesions in feral pigeons, and then usually it can be treated. On the right is an x-ray of a bird. You can't really see it very easily, but the lower left side of the picture, its leg is actually fractured. So fractures with our bird patients, we should consider if they're repairable, definitely, but it's really important to note that open fractures do reduce the viability of these repairs by about 70 to 80%. So if you have got a bird brought in and the fracture is open, I think it is kinder to euthanize, as amputation is not indicated, and as I said, the viability of open fractures is very, very low. So euthanasia is the kindest option in those scenarios. Another common injury is seen with our birds is our lovely cat attacks. So our furry feline friends do like to catch birds, and we more often than not do have them brought in after they have been attacked. So these injuries are definitely treatable if the skin tears are superficial. So that's the most important thing. If these birds have any deep muscle injuries, or cavities formed from being attacked, then the prognosis is poor, and so euthanasia is indicated with these birds. So we'll move on to hedgehogs now. So commonly seen injuries and diseases with these. So on the left is a poor little guy who's been stuck in a football net. So this injury is a constriction injury. So when these creatures get brought in, if they already have the material still on them, then we have to get it removed, and this may require a GA. So again, going back to our initial triage and assessment, let's make sure that these patients are as stable as possible before we put them under GA. So if the extremity seems uninjured, it's important that we allow 7 days in rehab to assess, because pressure necrosis doesn't always develop straight away. It can take a little bit of time. And if it does develop, then again, treatment depends on how severe, but it's not usually good news if you do get pressure necrosis. If the constriction is around the neck and it has superficial lesions, then this is definitely treatable. We can just manage the wounds appropriately as you would do with any dog or cat. Within reason. Dressings might be difficult, but it usually consists of a good clip and clean up. and then just giving treatment as indicated. And so on our right, I believe this is Strimmer Tim, if any of you remember this little guy. So strimmer injuries are a very, very common injury that we can see in our hedgehogs, especially as the spring and summer months come into play. So it really, with these, it does depend on the severity of the injuries. They can be treatable in some scenarios, such as this guy up here. He had a big strimmer injury across his neck, but because they have lots and lots of subcut skin, we were able to suture this back up together, and he healed really well and got rehabbed and released, which is always lovely news. The cases where it isn't treatable is if there's any kind of nose injuries. Now, this is really poor prognosis, and they are so reliant on their nose for smells and getting around. So, unfortunately, euthanasia is indicated if there is any kind of nasal injury. And also as well, if there's excessive degloving, it's not viable to treat them. It's most likely going to break down and cause more harm than good. And these animals will be suffering. It's extremely painful. I do remember one time I did have a strimmer injury come in, and it had basically degloved the entire back of the hedgehog, and it was awful to see. And you don't usually see hedgehogs making too much noise, but this hedgehog did make a lot of noise, and it was very, very painful, and it was awful to see. So we helped it ease its suffering by euthanizing these types of degloving injuries. On the left here, it's just an image of fly strike, which again is quite commonly seen on our lethargic and weak hogs that get brought in. So treatment for these guys would be to remove the eggs, which look like little rice grains, using things like a mascara wand or a small sort of flea comb is very useful to get these stubborn eggs off. If there's wounds present around the fly strike, we clean it up and assess them, and it depends whether it's superficial or deep as to what the treatment options would be. Unfortunately, in these cases, if maggots are present already, then it's too far gone, and euthanasia is indicated in these little guys. If we move on to the parasitic burden, now this you can't usually physically see, it's all sort of hidden within the poo. But you do tend to find that they're of very poor body conditioning score. So the example of this picture on the right, I'd probably say that was a 2 out of 5 for body condition. So if these guys come in, they're usually very shocky, very cold and lethargic. So we have to warm them really slowly. Fluids are very important, so nurses have that discussion with your vet about what they can have. Intensive care is most likely is needed. Wildlife rescues are definitely better equipped than we are for these patients. They have things like incubators, so they can control how quickly they get warmed up. So it's really important that once these guys come in and we give them their initial treatment, that they are then we then contact the wildlife rescues. And get them seen as, get them to them as soon as we can. We can also help our wildlife rescues by doing a fecal examination and potentially even treating what we see on that feces. It does help give them the kickstart, and the rescues would do it so as well. But if we can kickstart the treatment, I think that would be that's really good of us. And as well with these hedgehogs with parasitic burdens, they usually have ectoparasites because they're so lethargic. The ticks tend to go and crawl on them. So if there are any, let's get those removed. So I did want to cover these two not so commonly seen injuries, as I just thought they were very interesting and you very well might come across them. So on the left, I don't have a picture of Popoff syndrome, but essentially what it is the orbicularis appendicular muscle prolapses over the pelvis, and it prevents that hedgehog from naturally curling up, and it exposes its hind legs and tail. It becomes very vulnerable and can't really get around and walk. But it's important to know that this is actually treatable, which I didn't know. It looks very drastic, but apparently all you need to do is anaesthetize it, and when everything's relaxed, you can pull the muscle back down over the pelvis. Apparently you don't need to tack any muscles anywhere to stop it from popping back up. Apparently they just do really well with that, so I thought that was really, really interesting. And on the right is balloon syndrome. I've never seen this, but there's quite a lot of pictures around, sort of in your books and things. So this essentially what happens with balloon syndrome is there is a gas buildup in the subcutaneous area, commonly due to a bacterial infection that can be caused by trauma. The hedgehog essentially inflates and looks like a balloon as per the picture. So the treatment for this would be a decompression of the gas just using needle and syringe, a three-way tap maybe to make it easier. You usually have to do this 2 to 3 times a day, depending on how quickly the hedgehog inflates again. And then it's a course of broad spectrum antibiotics to treat the infection that is causing the gas. Okay, so hedgehog fecal analysis. Now, for this, it's really important to know that all hedgehogs will have some form of parasite burden. They will never be parasiteless. Normally they live in harmony together, but it's really important to know that if anything happens that reduces the hedgehog's immunity, so injury, illness, dehydration, that sort of thing, the balance becomes off, and usually we need to treat the parasites to help the hedgehogs cope and get back on to their normal parasite burden balance. When we get our hedgehog patients in and they do produce faeces, it's important that we do analyse this, as it's very helpful for the rescues, especially if the hedgehogs don't decide to poo in their care for a little while. Again, as with the dogs and cats, you can do a gross visual analysis of it. So the consistency, the smell, and the colour as well. Now, it's also really important to know that green poo in hedgehogs does not always mean parasites, and it does not always mean bad. This is because in hedgehogs, their bile is green. And they have quite a short gut transit time anyway. I think it's approximately 4 hours. But if they're stressed, or their immunity is reduced, or there's anything that can cause that gut transit time to increase, it does mean that the bile doesn't necessarily have time to change to sort of your brownie colour that we're used to, and therefore they poo faster, and the bile hasn't changed, so therefore it's still green in colour. So it is important to know that this doesn't always mean that we need to treat green poo. So when it comes to fecal microscopy, this is a very, very useful tool. I think everyone should know how to do it and learn to look at it. So the method to make a slide is that you place a small drop of faeces onto a clean microscope slide, and you add 1 to 2 drops of saline, mix it up and place a cover slip over it, and that spread out the content across that cover slip. And then you observe this under a microscope. Usually low magnification is fine. You may occasionally need times 10 and times 40 depending on what things you're looking for. The different things that you can see does vary, and here I've put together some common endoparasites that you do see within microscopy. So on the left, within the red circle, is lungworm. So usually you can see these wriggling around. They're full of life. Occasionally they can be dead as well, so they might not move. But it is sort of, you see through sort of long stringy type looking thing. The magnification times 4 is usually sufficient because they're a fair size within the poo. Treatment of this is Ovex, so mebendazole, 100 mg per kilo orally every day for 5 days, and then you repeat the same sequence after 10 days. You can alternatively use Advocate Dog if mebendazole isn't available in practice. The Advocate Dog dose is 0.3 mils per kilo, and that's placed on the underbelly as it absorbs better than where the spines are. And you do that every 14 days for 2 doses. And on the left, we'll see a capillaria egg. Now it looks sort of like an oval with 2 little nodules on either end of the oval. We call these the caps. Magnification, you can see it on ×4, but usually you can visualize the actual shape of it better ×10. So treatment for these, ivermectin, 0.4 mils per kilo, subcut every 7 days for 3 doses, so 3 weeks. The first dose, if you've got a very, very poorly hog, we usually reduce that to 0.2 mils per kilo, as because ivermectin is quite a strong drug, it can overload the hog a little bit and be a bit too much for it. Ovex that treats lungworm can also help reduce the numbers of this if the burden is small. So you can also use this if you need to treat for lungworm and just see what that does first. And again, as I said before, if you see a small burden, so in each sort of field of view, maybe like 0 to 1 in each field of view, I wouldn't necessarily treat for capillaria at this point if the hedgehog is otherwise well. So we also can get a egg called fluke. So this is seen on the left of the screen in the red circle. It's really important to note that these are half the size of our capillaria eggs, so if you ever see things side by side, it's good to note that the fluke is definitely smaller than these. It's best seen on ×10 magnification. If you ever do see fluke eggs on fecal microscopy, we do treat our patients for these. Fluke is quite a nasty parasite to have, and usually the hedgehogs are very poorly if they do have fluke. So if you do see it, definitely treat them. The treatment we can use is Profender-Cat. It doesn't matter what size, because it's based on the volume. We don't use the whole pipette. We get an amount out of it. The dose is 0.5 mils per kilo of body weight, and that's on the underbelly every 7 days for 3 doses. And then on our right, we've got Coccidia oocysts. So it's important to know that Coccidia is large. There are large and small versions of Coccidia, and all hedgehogs do have a level of Coccidia. We're more concerned when we see lots of larger ones, which is the ones that are within the circle, the red circle on that picture. They can be sporulated or unsporulated, and your larger ones are usually seen on ×10, but ×40 will visualize the shape and whether they're sporulated or unsporulated better. So treatment for this is oral trimethoprim or trimethoprim/sulfonamide. It can be subcut as well. The dose is 120 milligrams per kilogram for 7 days. Okay, so in summary, once triage and first aid has been received, if rehabilitation is indicated, that we need to create a treatment plan and contact a trusted wildlife rescue centre as soon as possible. Now, the 2 rescues that we work really closely with is the Yorkshire Dales Wildlife Rescue, which is formerly known as Craven Wildlife Rescue, and also Prickly Pigs Hedgehog Rescue. So do use those 2 as your initial contacts for rehab. Thank you. If you've got any questions, let me know. Contact me via email or message me on Teams. I hope you've enjoyed the talk.